Our minds will seek to go back over and over something until we take the learning. So most ages I have are the transitions, right? So going into college, graduating from college, and retiring. Okay. So that's all we're doing in hypnosis. Okay. We're relaxing your conscious mind and saying there's nothing for you to filter or worry about. You can relax and let the subconscious be in control.
Good morning, Traci. Great to see you here at Tracing Your Path in Somerville, New Jersey. Today we're going to talk to Traci about childhood trauma and healing it with hypnotherapy.
Thank you so much.
You're very welcome. Thanks for having me.
Yes, well, thank you for coming. It's nice to see you this morning.
You're welcome. Can you tell me a little bit about you, Traci?
Yeah, so I'm Traci Blank, and my background is in social work. I used to work for the state with kids with mental and behavioral health issues. I also worked for a nonprofit for a while, so my background has always been kind of with children and in the helping profession. And even before my work life, I was always the helper, with my friends. I helped all my friends find the colleges and their siblings find what college to go to and everything. And then really through my own anxiety and my own issues with different things, that's what led me towards hypnotherapy. And then I studied, one-on-one with somebody, and then I studied out in New Mexico at the medical school there, which is the best place to study hypnotherapy if you want to do the more medical setting. And then I've been working in hypnotherapy ever since, first at Morristown Hospital, doing mainly physical manifestations of stress and anxiety, and then for the past about 7 years on my own here. In Somerville, and I still get a lot of referrals from the hospital and everything, but I've kind of, done it on my own here, and I do both individual clients and also talks and workshops.
Thank you. Well, Traci, you and I met through your mom. Your mom's my accountant. Now, you mentioned that you had your own anxiety as a child, and you grew up in a two-parent household. Most of my work is for single parents, but there's anxiety in all households.
Yeah.
So do you want to speak a little bit about that, where your anxiety, not too much, but just kind of what triggered it, or?
Yeah, I've always had a lot of anxiety since I was a young kid. I was diagnosed with OCD, obsessive compulsive disorder, and generalized anxiety. Okay. And I was the kid who would wait till everybody else in my family was asleep and walk to each door and window, make sure it was locked before I could go to sleep. So I went to a child psychologist from a young age. And there's some thought that there was a trauma I suffered where our house was bombed, actually, because we were Jewish and we had our name on the mailbox. And there was this anti-Semitic wave, and I was about 4 or 5. And the electrical panel fell from the ceiling. I was in the middle of a Barbie workout with my mom, and she got my sister up. She was a baby, and we left. But ever since, that was a very strong memory for me. Yes. And ever since then, I've had a very strong sense of right and wrong and justice and fairness, and very out for myself. Not that my mother wasn't looking out for me, but I remember very distinctly her giving me a coat that was hers and me trying to say, no, I need my coat, and her saying, we just have to leave. Yes. And I was barefoot, and she made me walk through a puddle at night, So she was doing the right thing, but for me that felt like a traumatic thing. I think that might have caused more anxiety for me, but growing up I had a lot of anxiety around school, around flying, around anything that kind of came up, and it kind of really came to a head through social work, working with a lot of people. As much as I loved social work, who don't always want to be helped. Yes. That can cause a lot of burnout, and especially one of the biggest things I learned as a social worker is you can't want it for someone else more than they want it for themselves. Right. So I think it was a really good lesson for me being in social work, but it definitely heightened a lot of my anxiety. Yes. Trying to work towards solutions for people that didn't necessarily want my help, and you're kind of overworked sometimes in governmental work and everything like that. So Absolutely. It came to a head where I started getting daily panic attacks. To the point where I was passing out and I had to go on disability. I wasn't able to drive because I might be passing out, and I lost sensation on one side of my body and vision on the other side, and I had to go out to the Mayo Clinic in Minnesota, and they decided it was all physical manifestations of stress and anxiety, and that's what ultimately led me to seek hypnotherapy and learn about how hypnotherapy was so beneficial for anxiety.
And were you able to heal a little bit of that from your childhood, or was it when you got into hypnotherapy you were finally able to?
I think everything I've done has taken me to another level, and you think you're okay until you're not, and then you're like, oh wait, maybe there's more I need to heal. So, I was in therapy, which helps you to really process things, but maybe not truly move beyond it. You know, a very grit your teeth and move forward, and you're aware of your triggers and things. And then I was on medication for a while for the panic attacks, and even after I went out to Minnesota, before I looked at hypnotherapy after the Mayo Clinic, I went to an IOP, intensive outpatient, and that helped to some extent, but it was really, once again, hypnotherapy. I got off all my anxiety medications. I've never been back on medication, but I've never had another panic attack. I certainly have moments of anxiety, but I feel much more in control. It's not like, oh my God, I'm gonna get triggered, I'm gonna have to go on like more medicine. It's more like, okay, I know I'm going through a dark time. I need to like make sure I'm using my tools, but I know I have the tools.
Okay. The big question, what is hypnotherapy?
Yes, that's a big question because there's so many myths around it, right? But it's actually a very natural method of going into, you know, your subconscious that we all go into naturally every day. When you're driving away, you've gone a million times before, they call that highway hypnosis, when you kind of zone out.
Yes.
And that is the same mind state. So what it actually is we're going from our conscious mind into our subconscious mind and passing the critical factor, which is kind of like the filter, or I like to refer to as like the bouncer in the club. So when a new thought comes into your mind, the critical factor kind of checks the subconscious to say, does this thought fit with what we already believe to be true with our programming? And if it does, it lets it in to reinforce those ideas. But if it doesn't fit, it kicks it back to the conscious mind for more analysis. So in order to get into that subconscious without things being kicked back, we need to open that critical factor. So that's all we're doing in hypnosis. We're relaxing your conscious mind and saying there's nothing for you to filter or worry about. You can relax and let the subconscious be in control. And that's like the same thing like I was saying when you're driving that way in the beginning. And you're not unconscious, you're not asleep, but you're not really filtering and processing and analyzing. You're just kind of letting your subconscious be in control. And in that example, if the radio's playing, later you might hear that song and remember the lyrics, but not even necessarily remember where you heard that song. That's suggestion therapy. You put those programming in and it's coming out later when it's relevant.
Okay. Whew, that was a lot. Thank you, Traci.
Yes, it is. If that's too much, a nice, concise way I like to tell my clients is, hypnotherapy is knowing how the mind works and using that information to make your mind work for you.
Wow. What's the difference between that and the meditations I do in the morning? I do guided meditations, and sometimes we're like in space and focused on a certain object or golden, color. What's the difference between that? The hypnosis at a different level, or how? It's
the same mind state. Meditation, hypnosis, and actually like deep prayer are all the same mind state. They're usually used for different things. So traditional meditation, now there's so many different types of meditation these days, but traditional meditation is going into the subconscious to disconnect from all the overwhelming conscious monologue, right, in your head all the time. So it's just kind of going into the subconscious mind to get a kind of a break and maybe even be aware that you can choose what you focus on. Where hypnotherapy is going into that subconscious mind, but maybe doing some like feng shui, cleaning up the programming, adding new programming, changing the programming. So a lot of my clients, because I specialize in anxiety, like hypnotherapy a little better because they can get into that subconscious state, but staying there is hard. So this gives you something to do. Now, a lot of those guided meditations are a little more, I like to say, closer to hypnosis, depending on what the suggestions are. Like if they're talking about you're gonna have a nice day or you're full of energy, those are suggestions, so that's more hypnosis. If they're just kind of guiding you into meditation for you to kind of take a disconnect, then that is more traditional meditation, but it doesn't really matter, it's the same mind state.
Okay. What are some of the pros and cons of the hypnotherapy?
I don't really see many cons.
Okay.
I do think a lot of the cons come from like maybe the myths around Hollywood, and I do a lot of work both individually with my clients but also in talks and networking to make sure I'm really talking about, I can't control you, hypnotherapists can't control anybody, it's more helping you be in control of yourself. I can't make you be a villain and rob a bank or any of that kind of stuff. Those are probably like the myths that are maybe the cons in people's minds.
Okay.
But I think a lot of the pros around hypnosis and hypnotherapy is how empowering it is. Because you're getting all the answers from within yourself. I could tell you, I think you need to do this to be calmer, but you may or may not doing it. Hearing it from yourself, you're much more likely to follow through.
Okay.
Also, it's really a set of tools to use. So in sessions, I'm getting you to a better status quo and you're feeling great when you leave here. But now you also have tools in your toolbox to keep using to keep yourself feeling good as new things come up in your life.
Okay. Well, I don't know if you're aware of this, but the child sex trafficking industry, I hate to call it an industry, tragedy is what I call it, is very big. It's a multi-billion-dollar situation.
Yes.
Is there a way to help children in that situation who I'm sure are experiencing tremendous amounts of anxiety overcome that, heal, and live a healthier life? So.
Every trauma is really unique. Each person who experiences trauma is really unique, so it's hard for me to just say generalize this is going to help.
Okay.
But in general, some things that are helpful for anyone who's gone through trauma, especially to that level, and I have worked individually with clients who've gone through assaults or rapes or different things like that, maybe in childhood or more in young adulthood. But either way, it's really taking the time first to process it and kind of take the learning, right?
Okay.
Our minds will seek to go back over and over something until we take the learning. So sometimes really taking the learning can really help us let go of things, but it is important to give yourself a little bit of time to kind of process it first and then do it. And then there are different tips and tricks that you can use to help you on that journey to reversing the thought, right? So what we focus on is what we get. It is important, your mind will have you focus on it to get that learning like I talked about, but once you pull that out, maybe when you notice that thought coming up, reversing it to what you want to believe instead. Maybe a self-esteem thing often in that case, like I am worthy of happiness or I'm good enough or, any of those, a lot of those affirmations as well. There's a lot of different things that we can do, but also a lot of times people with trauma, it will take a more physical toll on their body. So they might start getting stomach aches, they might start getting headaches. So one thing I really like my clients to start to do is not just distract themselves when they feel that, right? Because then you're bottling it up and it's kind of reinforcing that it's okay to stay there. So kind of acknowledging it, saying, oh, I understand why I'm feeling this way.
Yes.
And it's something a lot of parents do for their kids anyway. If you just kind of say, no, you can't do that, right? They get upset and they say, well, why not? And your body's the same way. Right? It wants to feel a sense of being acknowledged, even if it's, going to then get reversed. So kind of checking in, saying, okay, I'm feeling this way because of the trauma I went through. It's okay to feel this way. It makes sense that it feels this way. Now what do I want to feel instead? Taking that extra step to acknowledge and validate yourself will go a very long way.
That's fantastic. One of the things I talk to single parents about is like working a lot. And the effect that has on children and actually causing trauma to the children by working too much. And one of the things I actually did when I was a single parent was I actually just worked. I never really coped with the situation, with the pain, I think, and I just was sort of just masking it with work. So in a situation like that, is that somebody you think would be a good candidate for therapy?
Yes, definitely. So somebody who maybe has to start to face that. We always say you have to feel it to heal it.
Right.
So to start to get in touch, to feel it, to understand what your body's trying to tell you by what it's feeling.
Yes.
One thing I recommend people start doing is a body scan. Check in with yourself. Start at the top of your head, and you can do this with young kids. I've done it with my 4-year-old, Start at your top of your head, scan your body, notice where that discomfort is, check in. Is that where you always feel it? There's a lot we can do with that then. But one thing I like for kids, but even for adults, because it's easy, is colors. So notice the negative feeling in your body. What color is that? Now see that color draining down and out. Now maybe notice where your body's comfortable. What color is that? Can you see that color filling in? That's giving your body directions physically what you want to feel as well. There's a lot we can do with that feeling too once we find it, to even ask it questions or what does it need to feel better, but that's something simple that you can kind of do on your own or with your kids, or that color dilution, and that can be a strong visual as well.
Oh wow. So what's your ideal client's age, ideal client, would you say, that you've seen a significant change in their
I've worked with all ages. My youngest Well, I work with my kids at home, with affirmation. I've worked with parents to create affirmations for their kids. The youngest I've had in my office really is around like 7, 8, 9, and I've had as old as in their 70s or 80s.
Oh my goodness.
So I've had all ages, but most of my clients are for some sort of anxiety, whether it's a physical manifestation or just they're getting overwhelmed or they have a fear or phobia. I will say the most ages I have are the transitions, right? So going into college, graduating from college, and retiring.
Okay.
Because those transitions, those changes cause a lot of anxiety to go on. But really, any client who's seeking a change or wants to feel empowered is going to be a good client. I would say most people I have, and I think this is a sign that parents are more willing to pay for their kids than themselves, are high school and college age.
Okay. Wow. Are there like 5 things you could give to single parents to help them to heal trauma, or anything
definitely.
Additionally you can add?
And some of these things might be based off of things we just talked about.
Sure.
So as far as like checking in and acknowledging and validating kind of a feeling when it comes up, there's a really simple acronym I really like out of Yale Positive Psych Department called RULER that they're using from kindergarten age up into the workplace to kind of teach people emotional regulation.
Okay.
And that stands for the R is recognize. So what do I recognize? Am I getting jittery? Am I getting a headache? What am I recognizing in my body is going on? Like that trigger. The U is understanding, giving yourself that understanding of the context. Why am I feeling this way right now? The L is labeling. Oh, this is anxiety. This is a fear. The E is expressing. How can I express this right now, even to myself? And then the R is then the regulating. Maybe I'm going to do some deep breathing. Maybe I'm going to go give somebody a hug that I know loves me and is going to make me feel loved. Maybe I need to like shake out the energy and do a dance party, but kind of going through that structure and giving your kids that structure can really help them, right? Because a lot of times we have this feeling come in, we're like, what do I do with this feeling?
Right.
So having a structure to go through can be really helpful.
That's wonderful.
I think that body scan we just talked about can be helpful for kids too, especially with colors. And seeing those colors drain out and come back in, that more comfortable
Do
color.
they actually physically see the colors?
They can close their eyes,
Okay.
especially kids tend to be very visual and have really good imagination. But even noticing where this feeling is and being able to tell your parents, you're saying, what color do you feel today?
Yes.
Or what, if they're more musical, what piano note do you feel like, anything to kind of check in and have them start to recognize what their feelings are and validating it. We'll start to get them more in touch with their emotions. A lot of times kids, emotion can be overwhelming for their parents. So it's like, stop crying, or, I'll give you a reason, or, other people have it worse, or even saying, I really understand, but I just, I have to work right now, or we have to get out the door. So giving them those tools, those techniques from a young age to kind of acknowledge their feelings is a really good step, I think, for a lot of kids. And along that same note, something I like to do with my kids is co-regulation. So starting to do deep breaths, even if your kid doesn't want to. I'll say to my kids sometimes when they're like hyperventilating, do you want to take some deep breaths with mommy? And they'll say, no! So I'll just start doing deep breathing, and whether they want to or not, they'll start doing it too. Especially like young enough to come up against you, they can feel your breathing. But you'll notice that even with adults in the room, right?
Wow.
Emotions are contagious. So if you settle yourself, you can kind of feel everybody around you starting to settle a little bit more as well. So I think co-regulation is a really, really great tool that we don't use enough.
And how young of could a child be to start with the co-regulation? Does it
A baby,
Really?
on the
Wow.
chest. I would put the baby right here, but a newborn even can do it. But as the child gets older, you might want to add even some simple affirmations.
Oh, wow.
And I always tell my parents, like an hour after your kid falls asleep, if you go in and gently rub their back till they just stir but don't wake up, you can give affirmations then, in the you form to them, the words you want. So what picture is it bringing to mind? Think of the pink elephant. If I say don't think of the pink elephant, what image comes to mind? Pink elephant. So maybe you're saying you're calm in all situations, or you enjoy school, or you in this situation, that you are loved, or that mommy's watching out for you, or whatever it is in the words that you know make sense for your kids.
And even when they're teenagers, you should be going and rubbing their backs and.
You can, and as they become teenagers, you can even teach them to start to do it for themselves. You know, looking in the mirror, saying affirmations, or taking some deep breaths and starting to go into more of a trance-like state. There's a lot that you can do, but even with teenagers, you can go ahead and go in and do an hour after bedtime as well. But it is a good age to start to empower them to say, here's a tool you can use. And I always find teenagers are a really good age. If once they realize it works, it's like, oh, it's amazing. Now I can do this for tests, and I could do it for, you know, dealing with this and that, you know. And along that note, something very easy too is seeing a stop sign, you know. Even kids who don't drive yet, they drive next to their parents, they see a stop sign on the road. They know what a stop sign is for. So if there's a reoccurring negative thought, maybe just seeing a stop sign. And then maybe eventually we reverse it to what you want, but seeing that stop sign can be a really powerful tool on a, you know, reoccurring ruminating thought.
Wow. That's powerful. How can people get in touch with you, learn more about you? How do they reach out to you? Are there any questions you think we needed to cover? But mainly, how can they reach out to you?
Yeah, so any questions, I'm always happy to talk to anyone about hypnosis and hypnotherapy. It's my passion, I love it. And so don't hesitate at all to reach out. You can call me or text me. In my office line does take text as well. So should I just say 732-595-2370. And then by email, Traci, Traci, @tracingyourpath.com. So again, 732-595-2370, or Traci, which is with an I, @tracingyourpath.com. And don't hesitate to reach out.
Thank you. Is there anything else you want to add, or your thoughts?
No, I think we talked about a lot of things. I can, you know, talk all day, but I don't want to keep your audience and everything. So any other questions that come up, like I said, don't hesitate to call me, text me, email me. You will not be bothering me, I promise.
Thank you.
Thank you.